Lifepak, and I'm doing a speech for my oral and interpersonal communications class. My speech is about our new EKG monitors. I'm currently a firefighter EMTI for Southwest Fire Department. We just got our Lifepak 15s this year, a couple months ago, so we're still all learning the ropes. We used to have the Lifepak 13, and we didn't have as many capabilities or gadgets as we do with the 15. The biggest thing for us now is that we now can do our blood pressures and our SpO2 monitoring on our EKG monitors. We never had that capability in the past. It came along kind of with the Lifepak 15. They finally decided that it would just be more efficient if we all were able to take it all manually. With the Lifepak 15, it's just the same as our Lifepak 13 ran, except we just got more to do. To turn it on, you just push on. Seems silly, but when to turn it off, you have to press and hold it, because people with the Lifepak 13s were pushing the on button instead of shocking and shutting down the whole system when you really need the capabilities. With taking the blood pressure in that, I'm going to use my assistant to show you how we do it. We like to take them manually first, just because manual gives you a more accurate reading sometimes. But when you're doing a million different things in the back of the ambulance, the last thing you want to do is try taking the time and getting your blood pressure when it's just easier to put the cuff on somebody and press a button. I mean, it's better. There's a lot of people that say taking it manually is the preferred way. Some people say taking it electronically is better. It's all up to you and up to your department, but I personally like to take my first one manually and my second one on the computer, my EKG monitor. I'm going to use my assistant here, and I'm going to take her blood pressure and her SpO2. So you want to make sure you put the right cuff on the right patient. So we have 3 different size cuffs. We have the large cuff for larger patients. We have the normal adult, and then we have a child's one. You need to make sure you have the right one, otherwise you're just going to get a totally obscured reading, and it's just not going to be beneficial to you or your patient. I'm also going to put our SpO2 monitor on her just so you can see on the screen what it's telling me. So in order to take her blood pressure, you just have to push the NBP. It's going to get tight on her arm. You want to explain that to patients because some patients just aren't used to taking their blood pressure, and you don't want them nervous. I mean, being in the back of the ambulance is already nerve-wracking enough without doing stuff to them they're not sure what you're doing. So right now her SpO2 is 100%, her pulse is 82, which is really good. And her blood pressure is still working here. Sometimes it takes a little longer, sometimes it doesn't. Her blood pressure right now is telling me it's 114/73. That's really good blood pressure for a female her age. One of the things I like the most with our new Lifepak 15s is when I have to do a 12-lead EKG. All of our leads now are color-coded. So before they were all just one color, and you're trying to figure out which color is what and where it goes. Well, now they all tell you. So for a basic 4-lead, you just need these 4 chords. You got your right upper, your left lower, and your right lower. You put them here, here, on your ankles. And then for doing your 12-lead, they all are colorful now. So you got your V1, your V2, V3, V4, V5, V6. And that all depends on the placement of where you're going to put it. You start at your 3rd intercostal, put V1, V2, and then you just kind of follow your left breast line in order to put your 12 leads on. That's one of the newer things of the Lifepak 15. The other thing is when we're doing CPR, and that when we arrive on scene at a patient who is down and CPR is in progress, 9 times out of 10, police officers are already on scene, and they're the ones doing our CPR for us. But when we get on scene, they have their AEDs attached. We like to use our own machine because now with the Lifepak 15, we attach our own pads to our patient, plugs right into the machine, and we can see everything. We don't have to worry about putting the 12-lead EKG on at that point. It reads your heart rhythm, it reads everything we want to know about the patient. Do they have a pulse? Do they have what? That way when paramedics get on scene, which are always dispatched for any of those types of calls, They can walk in and be like, okay, this is what's going on. I can see the screen. It tells me that this patient has no rhythm at all. And that way, like, with the Lifepak 15s, we are now with every other department within our jurisdiction. So we always intercept with the paramedic unit. When we do that, we used to have our Lifepak 13 and their Lifepak 15. So they would have to bring their EKG monitor into our call. We'd have to switch all the cords around and then redo everything we already did. The Lifepak 15, they walk in, everything's the same. Everything's identical. We don't have to worry about any confusion on which department is which. The other nice thing is, so I'm going to take a second blood pressure here. And when this never was capable on our Lifepak 13, after I take her blood pressure, I'm going to run a report. And that's going to tell me both blood pressures and the time I took it. We're in the back of the ambulance and everything is just going crazy. Looking at the clock is about the last thing we do. It sounds kind of bad, but I mean, unless it's really like medications, we always are looking at the clock. There's times where it's like, when was our second BP taken? When did we take the last pulse? If it's an easy call, it's not as bad, but when you are doing a call where 50 things have to be done in a 5-minute period, which is our normal transport time, I mean, it's just easier to be able to print something out and be like, okay, this is when everything happened. So if I print this right now, it's telling me right now that my lead's off. I don't have her hooked up to a 4 lead and I don't have her hooked up to a 12 lead. So it's just going to print all this stuff. It's going to print pretty much my whole call, which is nice for us because this tells us everything we want to know. It likes to print a lot of paper, we've noticed. So for some reason, instead of printing down the side like it usually does, it printed on the top. So either way, it's still telling me that on July 24th at 18:20 hours, her SpO2 was 80, her pulse rate was 81, her SpO2 was 98%, which is actually really good. The other nice thing with these is everything has its own place. It has its home. With our Lifepak 13, we pretty much just threw everything into a pile and called it a day. Now we have a nice place for everything. All of our EKG leads here. In this packet is our extra blood pressure cuffs. Over here is our cord to attach our AED pads for if we're doing CPR. And then in the back compartment is where we get all of our leads and all of our CPR pads. When we're using this, we try to take the best care as possible. These things are not cheap. They're very heavy. It's like a workout when you carry them. But, I mean, for being an EMT for a short while, using a Lifepak 15 over using a Lifepak 13, I would take it any day. That's basically everything we have about the Lifepak 15. It's different. I mean, it's not your usual EKG monitor. We have more capabilities now than we ever did in EMS, which is good for their patients because there's a reason why they're calling 911.